Beautiful ulcers, please.
Thank you very much for presenting my paper in this society. This article may be a world first trial for treat diabetic foot. I just share with you about my treatment. The case report, non-invasive ELCURE therapy can heal diabetic foot ulcers. I'm a plastic surgeon, and I opened my clinic in China also, Dalian, Beijing, for treat varicose vein. And diabetes affect whole tissue, including blood vessel, ligament, skin, subcutaneous, everything, nerve. So it decrease the blood circulation by arterial stenosis and lead to tissue necrosis and finally gangrene. The microcurrent therapy can reduce pain, inflammation, and promote cell healing by 4 to 5 times increased ATP production. Electrotherapy means act as electrolysis of lymph slots, and then finally electrical cell charging, improved blood and lymph circulation, and it can regenerate peripheral nerve also. Lymph system is very important, but many doctors and many medical staffs don't care about the lymph system because that is not very well developed in the world. Lymph fluid is about 12 liter, blood is just 3 liter. So if the blood circulation is not reached the area, the lymph circulation can make every metabolic processes. Another function is also detoxification and immune function, as you know well. So this is my diagram of the vicious cycle. When the cell stenosis, mitochondrial dysfunction, and decrease the cell membrane potential, finally decrease the microcirculation and the accumulation of lymph slots, and then inflammation, edema, fibrosis, and making tough bend. This is vicious cycle, and the ELCURE therapy, electric cure therapy, can affect every step of this disease progression. This is my device I developed, and then this is lymph slots, and then we can apply the electricity. It dissolves like this, small particle, and then excrete outside the body. So you can see the normal cell voltage is about 70 to 100, and then heart cell voltage is 90 to 10 millivoltage, and then the cell discharges about 50 millivoltage. The pain develops, and then every disease, chronic illness, chronic fatigue can develop, and then about 15 to 20 is cancer or cell death. So this is the cell electricity. Then ELCURE therapy can charging the cell from discharge to charging state. This is my device ELCURE 1000, FDA approved, US FDA registered. So cell charging theory. So Wagner classification show 1, 2, 3, 4, 5. The ELCURE therapy can apply the 1 to 3 stages. And the gangrene stage is not, there is no blood circulation, it is not different, just only amputation. This one, so this area can treat by ELCURE. I treated 6 patients still now, stage 1, 2, and ELCURE was applied once a week for 20 minutes. Every session are 20 minutes. and sessions at 20 times, about 5 months. Result, HbA1c decreased, granulation tissue formed, pain decreased. You see, this case is, at first when I started, is HbA1c was 12. After 4 months, it become 6 point and completely healed. Next, this is same patient, and this is progression. And another case, he is 66-year-old patient and 3 times amputated, and then before admission, HbA1c is 11, and after 6 weeks, 7 decreased, and then insulin stopped. The fast-acting insulin stopped, and then another insulin is dosage is 40 units to 20 units. The another case is diabetic foot progress, and you can see the granulation tissue here. Another case is when I start to treat 7.9 HbA1c, then after completely healed 6.7. Another patient is I treated and completely healed for 4 months treatment period. Another patient, 71, male patient, and completely healed. Maybe the session is around 20, but he doesn't have frequent visit as I ordered. So, the advantage of ELCURE therapy is non-invasive, no side effect, easy to apply, may restore temporary liver function by cell charging, and enhance wound healing, and another effect is nerve regeneration, peripheral. And then it's good to apply to the patient. No need of expensive dressing material. So conclusion. I have just 6 patients for the study. Long-term study is required, and then ELCURE therapy can be applied in the early stage of diabetic foot, and then it can reduce the rate of amputation. This is my patent. Thank you.
Thank you for your presentation and showing great results. Is there any questions from floor?
Hi, thank you for your lecture, and I want to know the price of the device and how much does the patient pay a cost for that therapy?
What is the first question?
Device price.
Device price. Device price is a little bit expensive. I can tell you later. And then this is just approved by Korean FDA a few years ago. It's not allowed by medical insurance system, not yet. And then we can try to receive some approval from the Korean government. So I treated this patient without any charge at the moment, but I add another item, just treat the diabetic foot, and I add another like injection material or something, brushing material. Then I add this cost to another. We need time in Korean situation.
And I want to know, when you tell the therapy to the patient, normally, how to tell? It will be, I want to know the period average period?
Average period, treatment
Yes.
period, yes. If the Wagner's patient 1 to 3, I recommend my patient for 6 months. And then every patient for 6 months decrease the HbA1c, that is normative, and then liver function also very good, improved. Yeah.
Thank you for
Thank you.
answering.
Any questions? Then ELCURE, your results show that ELCURE have a systemic effect.
Yeah, because electricity, when I apply the electricity here, electricity within very small time, within a few seconds, it charging full body, immediate. Yeah, high voltage, microcurrent.
Thank you. Okay, thank you very much.
Thank you.
We will move our next speaker.
Our final presentation is by Dr.